Hi, I'm Dr. Dave Janda. Welcome back to the Operation Freedom platform, the platform where we try to bring you information that you're not going to get from what I call the bought-off lamestream fake media. Prior to my work on the platform of Operation Freedom and DaveJanda.com and the radio show Operation Freedom, I practiced orthopedic surgery for 32 years. I had an opportunity in my career to take care of thousands of individuals. Folks that when they come to see an orthopedic surgeon, usually it's from an event that was unanticipated, were leading for them to have to come to the physician. A number of those folks were young, a number of those folks were middle-aged, a number of those folks were old. The bottom line with all those individuals is their life was adversely impacted. And when that occurs, there's a whole set of a cascade, if you will, of issues that develop. Folks that were middle-aged or elderly that sustain an injury, broken bones, dislocated joints, it impacted their lives to such a manner and a degree that there had to be some changes, significant changes made in their activities of daily living as well as their living situations. What I found after 32 years of practicing medicine is the vast majority of those folks, no matter what the age, were unprepared for this change. Hopefully temporary, but in some cases it was a permanent change. Over the years with my radio show, which started in October 2010, many folks had come to me and said, look, we have a real question about long-term care and long-term insurance and what we can do to, if you will, protect ourselves. You're the prevention guy, Janda, with all the research you do. Help us out here. It took me a number of years, actually, to find a professional, an expert, that truly was interested in the person as opposed to the insurance company or the almighty dollar. The person that I've come to rely on for the issue when it comes to preparing for hopefully a very happy later years in life. But the person who's the real expert on this and who really has outlined and helped so many of our listeners on the radio show is Susan Blais. And this is why I asked her to join me today on this YouTube, because our listeners on the radio asked me to produce a YouTube on this subject so they could share it with their family members, because this is a family discussion issue. This is not an individual. This is about a family discussing issues. A little background on Susan Blais. She has been an insurance advisor for over 30 years. As a certified long-term care professional, Susan has helped thousands of people be in control of their futures by preparing for long-term care. She's a member of the National Association of Independent Financial Advisors, which provides ongoing education for professionals who are committed to the highest ethical standards. Susan holds a master's degree in marriage and family therapy and is a certified coach. And this training helps Susan guide her clients through the complex issues surrounding aging and the life transitions that impact each individual. Susan has a passion for this work, and you'll get to see that very quickly just in our conversation, just as we start off. She is a frequent speaker on this topic in her home base of California, but she also, and this is where our listeners, because we have listeners in all 50 states, she utilizes the latest technology to serve clients all over the country. It's my honor to welcome Susan Blais. Susan, welcome to the Operation Freedom platform.
Thank you, Dave. It's always an honor to be with you and your listeners.
And might I say, folks can get in touch with you. You're very responsive, but Susan Blais, now the way Blais is spelled, it sounds like the fire blaze, but it's spelled B-L-A-I-S, SusanBlaisInsurance.com. We will also have that in the description section, the contact information for Susan. Susan, let's first start out with some foundational issues. What's meant by the term long-term care, and how, and many people have a question about how long-term care insurance works.
Sure. Long-term care refers to the care people need when they can't take care of themselves because of any of the issues you mentioned, whether it's an accident, an orthopedic issue, or long-term illness or just increasing frailty with age. And long-term care is defined as the inability to perform 6 very basic activities of daily living, which are bathing, eating, dressing, continence, toileting, and transferring. And transferring doesn't mean can you walk, but can you safely get yourself safe from a chair to the shower and to the bed without the danger of falling and hurting yourself. So if you cannot perform any 2 of those 6 activities of daily living because of any kind of functional issue, whether it's an orthopedic or an illness or frailty, or if you have a cognitive impairment such as dementia or Alzheimer's that prevents you from being safe in your home by yourself, that's when long-term care insurance would pay for you to get the care you need. Whether it's at home or in assisted living or in a memory care facility or whatever that is, you have a wide range of choice. But the bottom line is that long-term care insurance gives you the money to make sure you are well taken care of and that you don't become a burden on your children or your spouse, because that's a big concern for many people.
And Susan, so the question many people have, and it's interesting. A lot of my listeners have contacted me and said, I got this cold call. Somebody called me about long-term insurance, and I started talking to this person, and it just didn't sound right, what they were telling me. So let's go through some of the basics about how long-term care insurance works and some red flags people need to be aware of when they get those calls.
So how long-term care insurance works is the best way to prepare for long-term care is to buy insurance way ahead of time, similar to buying fire insurance on your home. You want to buy the insurance before the house burns down, right? Right. It's the same thing. So the least expensive way and the best way, where you get the biggest bang for your buck, is to buy long-term care insurance when you're younger, maybe 40s, 50s, early 60s are the very best. And how it works is that it will pay for the care you need when you have those can't meet 2 of those 6 activities of daily living, like I mentioned, or you have a cognitive impairment. And the red flags you need to watch when you're approached by anyone, whether it's on the internet or whether it's a phone call, is to ask some basic questions. Some people are attached to a specific insurance company, so they're only going to try to sell you what that company has. Mm-hmm. Whereas someone like me is an independent agent, I can access hundreds of products. And what I do is find what that person's particular interests and needs and goals are, what their financial situation is, what their family situation is, and then we look for the right solution for them. And that it doesn't take a long time. It may be a conversation, 20 to 30 minutes will generally give me a good idea. But that's how it works. And so the red flag would be to be careful if someone's trying to sell you something right off the bat. Because I'm very honest with people and say, let's just look at what the options are, and then we'll see if this makes sense for you right now or not. And sometimes it doesn't, sometimes it does. But you have to, for me, have to put the person and their family front and center. And if someone's trying too hard to sell you something, you should be a little concerned and ask a lot of questions.
There are many people that as they age, and I came in contact with this situation when I was an orthopedic surgeon, they said, well, I have Medicare for my health insurance. I have a supplemental. I've stashed some money away for, well, if there were expenses over and above what my health insurance is going to cover. And I don't know if I really need any type of long-term care insurance because, well, I have this little stash. What do you say to those folks?
What I say to those folks is 2 things. Number 1, Medicare does not cover long-term care insurance. It will only cover up to 100 days of skilled nursing if you're in the hospital for 3 days first as an inpatient for a treated condition, not just for observation either.
And that's a very important point, Susan. That's
right.
A very important point because that's one of the problems people get into. They weren't in for those 3 days for a particular issue. They were in overnight, and now they need assistance with some of the one of the 2, 3, 4 of the 6 that you mentioned earlier, and they're out of luck.
That's right. Medicare, by design, is not intended to cover long-term care. It's for short-term remedial rehab, get your back on your feet, but it's not going to have people come into your home and help you with your bathing, eating, dressing, cooking, buying your groceries, and that sort of thing, such as long-term care does. And the other part of your question about, well, I've got a little bit of money set aside. Well, it depends what a little bit means. The issue with long-term care is, and there's a map I have on my website that people can look at that shows, based on the city you live in, the state you plan to retire in, you can look at what is the cost of care today for various parts of care, home care, assisted living, and so on. And the issue is, say it's $3,500 in a particular area, in some part of Michigan today. Well, the costs are going up at about 3% a year. So in 20 years from now, when you're most likely to need it, if you're in your 60s, it's going to be double. It's going to be $7,000 or $8,000 a month. So most people who need care, by the statistics, need it for a year or two. And so you could easily go through $200,000 to $300,000 per person if you need long-term care. And if both spouses need long-term care, that can blow a pretty big hole in your nest egg. And the issue is, if you're paying out of your own assets, you are paying with 100-cent dollars. And the whole issue with insurance is leverage. So you may spend $1 in insurance premium if you start young and you're in your 50s, you buy a long-term care insurance policy, as an example. That dollar in insurance premium may value $10 or $12 of care much later on in your life. Whereas if you take those dollars out of your assets, you're spending 100-cent dollars versus 10 or 12-cent dollars, if you know what I mean.
No,
it's
that's
a very important discount.
That's a very important point.
Yep.
And one of the, going back to the Medicare issues, you mentioned 100 days. If you satisfy the criterion for qualifying through Medicare for post-hospitalization care, there's a finite period on that of 100 days.
At the most.
Right.
And they won't just necessarily give you 100 days. They might give you 30 days or 40 days, or based on a lot of the medical protocols, as you well know, are based on, is the person going to continue to improve?
Yep.
Right? And so if you're there 45 days and they say, that's it, we can't do any more for you, Medicare's done with you.
That's right. And it can be a very subjective process.
Right.
Where you're at the whim of some bureaucrat working through Medicare that says,
Right.
well, I think that person should have gained a bit more with their physical therapy, so we're just going to cut it off now.
Right. Yeah. It's never any fun to have to be in that kind of situation. And the whole point where Operation Freedom goes so well with this type of offering and this type of education is that it's all about freedom. When you're in your later years, although some people actually, about 40% of people getting long-term care benefits right now are not even 65, because accidents happen, heart attacks happen, cancer happens, where people might need help for 90 days, 100 days, 6 months. They can still get those benefits out of their long-term care. And so it's just so important to have a plan that protects you and keeps you free. That's what I say. You're going to have freedom of choice. I mean, it's just the way it is in our society. If you have the money to get care, you get to choose where are you going to be, who's going to take care of you, and whose rules are you going to live under. Because people say all the time, oh, my kids will take care of me. Well, that goes back to your issue in the beginning about discussions. Do your children know that that's the plan, first of all? Have they volunteered for that? And do they know what they're getting into? And sometimes it works great. Sometimes it doesn't work so well. Because when you're under someone else's roof, even if it's a beloved child, they're paying the bills. You're under their rules. And when you have this type of insurance, you get to decide. And it just gives a lot more freedom and independence and keeps you from being a burden on your children again. Because when you're a burden on your children, you're also a burden on your grandchildren. If your adult son or daughter has to take care of you, well, that takes time away from their children. You don't get to go to their soccer games. You might not have as much money to put aside for education. It's a family issue, as you said, and it mushrooms throughout the generations. And it's not fun for people to think about, but it's so important.
So when I was taking care of patients, some folks would say to me, okay, well, here I am, 60 years old. I was planning on investigating the issue of long-term care insurance, when I turned 65. And I'm 60 now, and I'd anticipate this event happening, and I need it now, and I messed up. So the question always comes up, Susan, what's the best age to investigate long-term care insurance, buy long-term care insurance? Because frankly, Susan, there are two things that a lot of folks have a hard time doing. There are many things, but two things when it comes to the future. One is sitting down and writing a will. And the second is sitting down and having the discussion about long-term care insurance, because actually just acknowledging both of those issues, you're either you're acknowledging your death, which many people don't want to look at or face, and the other is that you're not as healthy as you are currently or have been in the past.
Right. So the first part, if you're 60 years old, and especially if you're still in good physical condition, because traditional long-term care insurance is an insurance that you must medically qualify for. So the younger you are and the healthier you are, not only the easier it will be to get, the much less expensive it will be for you to get, because it's rated on your age and your medical condition. So, and even though it sounds counterintuitive, if you were to buy it in your 40s, your lifetime cost will be much less than if you wait until your 60s. But assuming you are 60 years old and you haven't taken any action on this yet, you can still get a policy. It'll be more expensive than it would have been if you bought it 10 years ago, but we can still usually find something that works for the budget. And also, one thing that very few people know is that if you currently own life insurance or an annuity, you can often trade those in for a policy that does include some sort of long-term care or chronic illness rider. And that's a whole new era in long-term care planning, is these hybrid policies that include life insurance or an annuity, but have a rider on them so that you can use your life insurance benefits while you're alive if you need long-term care.
And that's one of the interesting points that my listeners have brought to me after they've had discussions with you, Susan, is when they first got a call over the phone from, just a cold call, they were told there's only one kind of program, one kind of policy, this is it, take it or leave it. But in fact, that is not the case, as you just outlined.
It's absolutely not the case. And there are new products being developed every year with all kinds of different nuances about how they pay the benefits and so on. And I make it my business to learn what those are. And I only deal with the top-rated insurance companies. It's important that you put your money with an insurance company that's been here for the long haul, is going to be here for the long haul, and is going to pay your claims accurately. But there's new options all the time. And the hybrids with the life insurance, for example, with a long-term care or chronic illness rider, really work for a lot of people, especially if they have children. Because what some people object to with traditional long-term care insurance is what I call the use it or lose it. It's like fire insurance. You pay your premium.
Right.
You either have a fire or you don't. Not that you want to have a fire, so you use your insurance. Same with long-term care. I have two policies. I hope I never use either one. But if I don't use it, okay, that premium is gone, but I still feel it was worth it for me. But the life insurance long-term care hybrids will always pay a benefit to someone, either the policyholder while they're alive, if they need long-term care, or their beneficiary once they pass. And a lot of people like that better because they feel like, all right, I know somebody's going to get a benefit.
That's right.
And it's also leverage, because if they pick a number, $50,000, they're going to invest in this life insurance long-term care policy. Immediately, that $50,000 becomes a bigger benefit depending on their age. Could be anywhere from $80,000 to $150,000. Depends on their age and their health again. But they're going to treble the money in their estate. And it's going to protect them. It's going to protect their beneficiaries.
Let's talk about the expense. How expensive it is to buy long-term care insurance.
That's such a hard question because, again, it depends on your age. I will tell you, I just sold a policy to a 40-year-old male, very smart young man, who was planning ahead. His financial planner said, you need to have at least some kind of long-term care in your portfolio. He bought a policy that he can pay off in 10 years, which is also something that business owners can do because long-term care insurance premiums are tax deductible, by the way. His premium was about $1,800 a year. He'll pay for 10 years, so for a total of $18,000. But he will have, by the time he's 84, which is the age we usually use to look at what will the benefits grow to, he's going to have over $300,000 in long-term care benefits in that policy for $18,000. And once he's 50, he will never pay another premium for his whole life, but he has a paid-up policy, and off he goes. So that's one extreme, let's say. That is one of the smartest people I've ever met because he's going to be done with it at a very low price, and then he has a policy for life. If someone's in their 50s or 60s, again, depending on their health, we're going to be looking, some people want to do a monthly premium. The truth is, we can tailor a policy just like life insurance. You can buy $50,000, you can buy $5 million. What do you want? How much insurance do you want to buy? We can look at their monthly budget and we can kind of back into something down to $100 a month or less, even depending on their age, up to several hundred a month, depending again on what they want to buy. So it's one of those things. You can pay as much or as little as you want to or as you need to, and even if you only buy a policy that's not going to cover all your assets, anything you have when you need care is going to beat the heck out of digging into your savings from $1 at 100-cent dollars to pay for care.
Many people have asked me, well, okay, so I purchase a long-term care insurance policy. How do I know when I need it in 20 years that the insurance company won't change the rules about whether they're going to pay for this assisted living facility or this nursing home or this person to come in and provide me home care?
That's a great question. The policies are designed to, now all the policies that are sold, some of the early policies, which we discussed on an early show, some of the early policies when long-term care insurance was brand new and people didn't even know what they were looking at really, were kind of restrictive. Now the only policies I will sell, frankly, are comprehensive. Okay. So they're going to cover you for home care, for assisted living of all different flavors, for adult daycare, and for nursing home, which no one wants to go to anyway, or memory care, right? That's kind of the big spectrum. Right. Those policies, those contracts are set in stone, and they will pay for those services. So
that's key. So when a red flag might be, well, you can get a pretty good deal on this, but it's only going to cover home care, or it's only going to cover nursing home care. You have to look these days to find a policy like that. Yeah, right. And I wouldn't sell it. To me, I want to sell a comprehensive policy because you don't know what situation you're going to be in 20 or 30 years from now. And so I prefer the kind that gives you the widest choice possible of the options where you can live. Now, Susan, you had mentioned earlier today that folks have to qualify medically for this insurance program. What happens if a person cannot qualify medically for long-term care insurance? What else can they do to protect themselves?
There are so many things, and I'm really glad you asked that question. One of the things they can do is, again, if they already own annuities that they haven't yet gotten to the point of surrender. Usually there's a point 4 or 5 years that you would have to pay a surrender charge for that annuity, but often you're past that point. Mm-hmm. You can often trade that in for an annuity that does include long-term care. And in fact, there's some that are designed specifically for the point of need so that when you do get sick, that's when they want to hear from you, which is a new thing also. But so that's still in the realm of insurance and annuities, right? Sometimes you can just buy an annuity that's going to guarantee you a particular amount of money every month for the rest of your life. Mm-hmm. Sometimes we look at things that are not even in my realm. I don't sell things like reverse mortgages. I don't do refinance on home mortgages. But sometimes that's an answer for people because sometimes their biggest asset is sitting in their home.
Right.
And they don't necessarily have to sell the home. There are some new types of reverse mortgages. The old ones kind of had a bad reputation. There's some new ones. They're called home equity conversion mortgages that can really help people. And some people also specialize in helping you refinance your mortgage to give you a bigger cash flow or to move the assets from one place to the other. So there's all kinds of ways people can prepare for this that don't necessarily involve insurance.
Another question that comes up with folks is they say, okay, I decided to buy long-term care insurance in the past, and it was affordable, but now I'm getting premium increases. And I'm told, the person said, I was told by someone that, there's nothing you can do about a premium increase. Is that necessarily the case, Susan?
Absolutely not. It is not the case that you can't do anything about a premium increase. Long-term care insurance does not have guaranteed rates, where some of these hybrids with the life and long-term care do. So that's one issue. But if you have a rate increase, in fact, I helped one of your listeners with this very issue. A lot of people might have bought the policy from an agent they knew 20 years ago, and they have completely lost touch with that person. I will actually help them talk to the insurance carrier and get options. You might be able to trim a little benefit here or there, prune the benefits, but you still have a good policy left, and you're going to reduce the premiums that will happen at the renewal. I have a special calculator I use to help you really look at what are the different options and what will it mean today and what will it mean 25 years from now when you're likely to need the money. And so it's very, very doable to get the insurance company to give you a different option than just taking an increase.
My dad was like this. He said, look, something happens to me. I want to remain at home. And when my health changes, that's the way I want it to be. So my question is to those folks, what are some of the things they need to consider?
Also a great question, because here's the way I see it. After seeing literally hundreds of people, right, that need care, some have insurance, some don't have insurance. One of the big things I always say to people who want to stay at home forever is it's great. It's nice if there's someone there with you, right, for one thing. And it's great when you're feeling well and you're mobile and you can get in your car and drive down to the coffee shop and meet friends and go shopping and do things. But when you're not feeling so well and your health starts to decline, especially if you're living solo, it cannot be the greatest lifestyle to be feeling kind of miserable and in the house with your TV and maybe a cat or something. It's not necessarily the greatest way to spend your later years. And so I always encourage people to go out and look around your community, because I guarantee you, there are assisted living facilities there of all types. Small homes that might care for 4 or 5 people in a very home-like environment, all the way up to the big facilities that I call cruise ships on land, because they have so many amenities and clubs and activities and parties and concerts. It's amazing what they offer. And to go take a look at those, and to way before you could even consider needing it, and to just see what's available, because you might think, that might not be such a bad idea. I personally will have no problem moving into assisted living at some point when I don't want to take care of the house anymore, the gutters, the yard, all that stuff. I want someone to cook for me. And, it's just amazing the facilities that are there and the services they offer. And so looking at that stay at home forever thing, I would say just do some investigation way ahead of time and see what's out there and see if that's really what you want to do. Because sometimes it might be nice to have people outside your little apartment that you can socialize with.
When I was treating folks, it's interesting. You're right. There's some people that want the cruise ship on land effect. Some people that like a nice, if when they're going to leave their home, they like the assisted living facilities of various, if you will, flavors. One that I found to be very interesting. some of the happiest people that they didn't want to leave their home, but they had to because of an illness, because of a physical condition, was folks that actually went to a group home, if you will, facility.
Right.
And when I first heard that, I thought, but all these people said, as much as I didn't want to leave my house and I fought my kids, this turned out to be great. And they would say, without a hesitation, it's also more cost effective than the cruise ship on land thing. And these people would say, I'm getting everything that I would have really there at the small group home. Could you address the issue of the small group home? Because many people here, because I was guilty of that. When I heard small group home, I go, how's that working? But
yeah, it's amazing. I know personally in my neighborhood some people who run one of those in California anyway. They call them RCFEs, residential care facilities, and it's in a house in a neighborhood. You would not know that house, if you drove by, was any different than any of the other homes. Mm-hmm. And they have 5 or 6 residents. And the man and his wife who run it used to be in the hotel industry. And I'm like, now that's the place you want to be.
Is the place. Yeah,
you would not believe the meals they prepare for these people. And residents will come in, and they all have their own rooms. So some of them share bathrooms, some have their own bathrooms. But it's a beautiful home, beautifully decorated. They can have their pets with them if they want, and they have a beautiful yard. And they cook them amazing food. And it's like, what's your favorite food? Okay, it's shrimp. Whatever, right. Shrimp almondine or whatever it is, and they'll make it for you. And it's very personal, very, very friendly and warm. And if you want to go to the store or something, they will have someone drive you. They don't. It's not like they're stuck in the house all the time. They'll have people. They will take outings, and so those can be much less expensive than one of the cruise ship on land situations. But some people just love it because they're in a home and they feel completely at home, but they have people to talk to when they want to, and they can go in their room and get away from them when they want to.
Right. Susan, what's the biggest mistake people make when it comes to long-term care insurance?
I would say the biggest mistake people make about long-term care insurance and long-term care planning in general is to wait too long, is to not think about it. The earlier you think about it, just like the earlier you start a savings account or an investment account, the better off you're going to be later in life. When you think about it early, make a plan, talk about it with your loved ones, and if you started exploring what are the options to get coverage, whether a long-term care policy or one of the hybrid policies with life insurance we talked about, the earlier you do it, the better. Because there's nothing like the peace of mind for knowing that is taken care of. Now, all right, that big risk is taken care of. I can just live my life. I can have freedom when I get older to decide where I want to be. I have the money to pay for it, and I'm not going to be a burden on my kids. But think about it sooner rather than later. Don't let denial rob you. I say that all the time because denial is a thief. Denial, saying, I can't think about that. That's never going to happen to me. I hear all these crazy excuses. People say, I'm going to stick my head in the oven. I'll shoot myself. Right. Sure you will. That's not a plan.
No. Or not a good plan, that's for sure.
Not a good plan.
Not a good plan.
Think about it, face it, just like any other risk in life, and deal with it sooner rather than later. At least get the information. And
something you have pointed out on our show before is communicating with your family about this. That this is not a one-person decision. And I know you do this. I know my listeners have told me that when they contact you, you're always happy to have, and you do work for folks all over the country with the technology now through Skype, through Zoom, through over these. Right. They say, we had a family meeting over the internet, even though my kids live in New Jersey and I live in Chicago and my other kid lives in Texas. Well, she got us all together, and we had
easy. Yep.
And that's really important.
It is. It's really important. And because then everybody's on the same page. See, back to the question about what's the worst thing you can do.
Yeah.
The worst thing you can do is not have any plan, and then a crisis happens.
That's right.
When a crisis happens, oh my God, mom fell and broke her hip, or dad had a stroke, or something really terrible happens, and the kids are all over the country. No one's got a plan. Everybody gets into a panic. And panic is not a good place to make good decisions from. As I'm sure you're aware as a physician, really poor decisions can be made in a time of panic. And so don't let that happen to you. I plead with people, don't let that happen to you. Think ahead, face the issue squarely, and make a plan, whatever that plan is. And let's make sure that all of your family members are in agreement and everybody gets what the plan is. It saves everyone so much heartache.
Susan, you're the best in the business. You're also the most honest in the business. And as you know, I'm not a big fan of insurance companies. I'm not. I do believe insurance serves a role, whether it's health, fire, casualty, long term. But one of my concerns has always been, well, the insurance company's doing fine, but are they servicing their clients? And this is where you come in. You see,
absolutely.
You are the and you. I know you, and you tell people exactly what they need to know and what will protect them and serve in their long-term best interests and their family's best interests. And that is, as listeners have told me, Susan is fighting for me. She's not fighting for that doggone insurance company.
Mm-mm.
And this is why, Susan, I have you on the radio show, and this is why our listeners have benefited from all of your efforts and all of your knowledge and your recommendations. So if folks want to get in touch with you, we're going to have your website listed in the description section underneath this video, Susan Blais, Blais, SusanBlaisInsurance.com. But so they can go to the website where you have information also on long-term care issues.
Right.
But are there other ways they can get in touch with you?
They can call my office, which is 805-475-7900.
Say it again.
805-475-7900.
And you're also available through email through your website.
That's right. There's actually a quote form on my website. If people choose to put their information in there and tell me some basic things about them right away, then it just makes our conversation that much more focused when we get on the phone.
And one of my listeners said, "Yeah, I don't know. I just had a hard time facing this, so I asked my daughter to give a call." And you're fine with the daughter calling or the son calling or the spouse calling and saying, "Hey, we want to talk a little bit about this, and and you're fine with that."
Absolutely. I really feel that my job is to educate people.
Yeah.
Not all the people I talk to become my clients, and that's fine. Mm-hmm. I can often, in fact, a veteran, one of your listeners called, a delightful woman in Texas, and I am not certified to sell the veterans benefits, and she didn't know if she had any benefits coming to her or not as a veteran. I got her in contact with the Veterans Aid and Assistance people. She found out she has a nice benefit, and she's thrilled. So even if I can't help them personally, I try to send them off to a resource that I know will help them.
Susan, I'd like to thank you. You are an incredible person, but you also provide incredible resources to protect people. And I wish there were a million Susan Blaises around. But we're fortunate there's one.
Well, thank you.
And I thank you for everything you have done, are doing, and will do. You are an incredible person, but you're an incredible person because you help so many people. And I thank you for that.
Thank you, Dave. And all the same to you. I'm so honored to be part of your group, your family, and the listeners that you have are incredible people. I am just so excited about the people I get to speak to all the time because they listen to your show.
Well, we have a fantastic freedom family, Susan.
We do.
Our family at DaveJanda.com is incredibly giving group that when we do an interview, they say, get this out on the public side because this will help so many people. Don't just save it for us.
Right.
And that's what our family's about. That's what our Freedom Family's about. And I thank you, and I thank you for being a member of our Freedom Family, and I thank our listeners for joining us today. Until next time, Dave Janda signing off. Dream big and dare to fail. Thank you for your time today.